Good morning, ladies and gentlemen. I want to welcome you back from the health and commercial break. That was indeed desired after the morning session, the plenary session, which was quite intriguing. And we are going to have another very interesting session here. We have Dr. Everlyne Rotich, who is going to give us the keynote address. And now I welcome Dr. Edward Moka to come and do the introduction.
Thank you, Dr. Amimo. Ladies and gentlemen, allow me bring to you the Honorable, I call her Mheshimiwa, the Honorable Dr. Everlyne Rotich. Dr. Everlyne Rotich earned her PhD from University of Cape Town, and she earned her Master of Science in Midwifery from University of Nairobi. Her first degree in nursing was right here in this university. Yes. Work experience. Today, she is a CECM for health in Uasin Gishu County. CECM is County Executive Committee member, okay? Maybe to simplify it further for Dr. Biru, that is an equivalent of a minister at the county. Yeah. Yes. She is also a senior lecturer at Moi University on leave of absence. In 2001 to 2004, she was a nurse manager at MTRH. Between 1997 and 2000, she was a nurse at Aga Khan. And she has also been an ICM, Regulatory Board Representative, Midwifery. Between 2010 and 2014, she was a board member and indeed a powerful chair of the Nursing Council of Kenya. And in terms of research, she has several presentations at international conferences. Madam Everlyne Rotich, we are happy to have you here at our 7th annual conference. Karibu sana.
Thank you very much, Dr. Moka, first of all, for inviting me to this presentation. I don't take it for granted. I'm humbled. It's an honor. I left this campus 24 years ago in 1997. And I had both a nice time and also challenges. And I enjoyed every moment. I learned every moment. But there's one thing that I appreciated. By then, Dr. Millicent Ojwang, thank you very much, was more of a mother to us. She took care of us. She was Dean of Women. But of course, we didn't, I wouldn't say we went without having issues. And I would request for permission to disclose one thing that I think happened while I was a student. I remember when I was about to finish my studies, we were very naughty students sometimes. We would strike when there was no water, hot water. We would go and sit in. And it's just because of the, probably it was the age and that time. Then there's this one time we had a blackout. Then a friend of mine came and threw waste outside of the room. But I was punished because I didn't disclose who it was. And anyway, I said, those are lessons that we learn in life. But I would like, the person, of course, didn't also come out to say, no, you have punished the wrong person. But you know, those are experiences we go through when you are young, and also when you mature, you end up learning. I have had several experiences. Of course, that built me. I appreciate that I am where I am because, first of all, of Baraton, the values that it's taught me, and this has helped me in going out there. You find that here in Baraton, we were brought up in an enclosed environment, you're protected, but once you reach there, you realize that, oh, you are out in the world with the different people from different spheres, different religion, different backgrounds, but all the same, Baraton helped us grow, and we are who we are today. Then my name was Everlyne Nyangwari. I don't know whether that brings... Now she knows me now. But now that I'm married and I have children, I am now, the Rotich is the name of my husband. I appreciate that. When I was told to present today about one of the sub-themes in the conference presentations, of course, my bias is in health, so I definitely had to do what I know best, and that is why I did on emerging, re-emerging, and controversial issues affecting health. And as you have been told, I'm the County Executive Committee member in charge of health services at the County Government of Uasin, Gishu. And I'm a senior lecturer at Moi University. I'm on leave of absence. Yes. So my presentation, the outline of my presentation, I'll be talking about just a brief introduction of the things affecting us. We have global contemporary issues, determinants of health, historical perspectives on disease etiology, emerging, re-emerging diseases, other pandemics and interventions, and then the COVID-19 situation in Kenya, and then controversial issues in health. That is just how I will be doing my presentation. And there are several contemporary issues affecting us in the world. As Professor Lando talked about working from home, I said she's preempting my presentation. But thank you very much, Professor Orlando. I mean, I appreciated your presentation because you have known I'm an academician, and there's that famous phrase, publish or perish. For you to reach certain level in academia, you really have to publish. And I like the challenge that you're telling us to do action research, things that will actually contribute to change in our environment, in our health sector, everywhere in our country. And the contemporary issues that have affected, long time we could hear of wildfires in the US, but because of now, we have seen the climate change, we have seen floods, we have seen overflowing of lakes in some of the lakes, like Lake Baringo, Lake Bogoria. I used to like going to Lake Bogoria to see the hot springs. It's no longer there. And those are some of the contemporary issues that really affect us. And you'd look at some of them, the major ones are like food and nutrition. Without food, we have seen what is affecting us really. We have seen a lot of poverty, hunger. We have seen issues in education, the lack of education, and in countries that we have had, in areas that we have women empowered and provision of education, like even in Kenya now, the free primary education really provided an avenue for many people to access education. There are also gender issues that affect the global world. We have issues to do with positions, political positions, leadership positions, gender-based violence. Those are some of the issues that affect us. We have environmental factors. I think I talked about the climatic conditions. And then we have political dynamics. What happened recently when we had a political, like I would say political instability in the US. We saw what was happening in the old world because they control the world. And if they are having that political instability, we saw what we would had a lot of noises, which has subsided now. And then you have, even in Kenya, the handshake, the different manifestos. All those are global political issues that really affect us. I've mentioned this. This is just a diagram that just illustrates that. And you can see what we talk about climate changes. You can see submersion of very good hotels. If you went to some of those hotels, they were built, but now they've been submerged in water. We have lost lives, we have lost schools, and it is because of the climate change. We have also environmental pollution. We can see the effects of environmental pollution. We can see poverty and hunger. Those are some of the issues that really affect us. Now, to go into my main area is on the determinants of health. And determinants of health varies across individuals, population, religion, income, education, and occupation. If I talk on religion, what we eat really affects our health. And I would appreciate that I said I grew up here. I went to school here, and we had one of the very best meals. We used to have purely vegetarian, and very well done. And those are things that really affect our health. And some of the things that also affect our health are our personal, like the age, the sex, genetic makeup, the lifestyle too, cigarette smoking, alcohol consumption, lack of physical activity, and I'd also mentioned the diet. The good thing about some of the environments like here, Baraton, you have a good environment with a lot of trees where you are able to breathe. When you talk of the living conditions, you breathe, we need oxygen. And during this COVID time, we have seen actually the importance of oxygen. In our hospitals, what is keeping our people alive is just availability of oxygen. And we thank the university fraternity for doing such a wonderful job. At least you are contributing to this oxygen. A human being requires a lot of oxygen to survive, even though we can't really harvest it for the sick person in the hospital. But these are some of the issues that they are determinants of health. Other determinants of health are conditions in which people grow, they are born, where they live, they work, where they age, their networks, socioeconomic issues, cultural conditions, and also the health systems. If we have a health system that is not functional, it means people will not access the health that they need. And in conditions in which people grow and live, if they grow really in places that they don't have enough food, definitely there are issues to do with stunted growth. There are issues to do with communicable diseases. And also determinants of health are influenced by money, power, and resources. I want to go back a little bit to the history of disease. And in early Greece, it was assumed that events of life, including calamity and illness, were the result of metaphysical factors and mystical powers. Because people didn't understand the causative agent of disease. They associated it with other bigger forces, and that is why disease occurred. And even still up to now, disease is associated with other forces in some communities, with witchcraft. There are also some religions that also, if I would talk about that do not believe in seeking health care once they get sick. And those probably I'll talk about when I talk about dilemmas or controversies in health care. And according to Apollo, invisible arrows were used to inflict pain and suffering on the condemned. That is just the historical perspectives of disease. And the Greek physician Hippocrates challenged the popular paradigm that supernatural forces were the driving force behind disease. So Hippocrates now decided to find out what was really the cause of disease, and also came up with the Hippocratic Oath when he realized that some doctors were being bought to give poison to patients, which really killed people because they didn't have medicine or the right etiology then. And Hippocratic Oath resulted when they witnessed physicians who were bribed to poison. I think I've talked about that. And Hippocrates observed divergent population health in differing locales, dissimilar individual constitutions from birth, variations in health related to diet. I think I had mentioned that. Nutrition and he concluded that nutrition factors, inborn factors, and environmental influences were major determinants of sickness and health. And most of the nutritional deficiencies arise from toxic exposures, genetic predisposition, infectious agents, like now we have the pandemic now, the coronavirus going on, and psychological dysfunction. And theoretical models for influenza and other transmissible respiratory diseases consists mainly, actually they have mentioned three ways of transmitting the disease, which has an agent, host, and an environment where these interactions occur. When we talk about emerging and re-emerging diseases, when I heard about, when we experienced the COVID-19 pandemic, at first, before we went back to history, we knew this is a pandemic, it has occurred. Then we went back and realized, oh, this is something like a repeat that has occurred 100 years after it occurred. The first pandemic was in 1918, and it killed very many people, 100 million people in the world, and about 680,000 in the US alone. And the hardest hit countries were countries like India, which 15 million people died. There was also the pandemic. If you remember in 2009, there was the SARS pandemic. Even though it wasn't really, it ended very fast and it didn't spread across the world, it killed over 575,000 people. And usually the pandemics, what we have seen, the diseases are caused, they are associated by a loss of immunity to the virus. Because usually, like this coronavirus, it is very contagious, it's highly contagious, and the effects are made worse by existing infectious diseases like TB, and even now we have seen COVID-19 patients actually dying of pneumonia, most of them the respiratory conditions. And we can talk of, I have just mentioned some of the histories of the COVID-19, the influenza virus. There are also other pandemics. It's not only the influenza virus. We had in the 15th century in Venice, where outbreaks of plague were combated by convening the Lazaretto Vecchio. I don't know whether we remember those in history. And this is where people who were taken who had plague were put aside and kept in a place. Even in cholera, if we can see when there was a cholera outbreak in the 19th and 20th century in New York cities, travelers were quarantined. And also this led into, as a result of the pandemics, that is when governments decided to bring in policies and zone areas, and also brought in policies for proper sanitation. And sanitation, as you will see when we go on, when we got to hear about COVID-19, now that is when you were told, wash your hands, sanitize, and I can see now, around here there are a lot of hand washing basins, we have hand sanitizer, we are social distancing, And those are the interventions that have been brought into place. And I think I have mentioned about the influenza that came in. So the COVID-19, dwelling into the COVID-19 outbreak, it was considered an outbreak in January 30th in 2020 by WHO. That is when the Director General of WHO actually said, now, I know the first instance occurred in December 2019 in China, but it was now declared a world concern, January 30th, 2020. And around March 4th, that is when Kenya had its first case of COVID-19. And COVID-19 is an acronym that is created by WHO for the respiratory disease caused by the novel coronavirus, severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, which stands for coronavirus disease of 2019. And why are there challenges? Why aren't we able to handle coronavirus? We would say we fairly have functional health systems, but why aren't we able to handle coronavirus? Because of the spread, the highly contagious nature, and most of these viruses require vaccines, and it takes a long time before a vaccine is developed and distributed for use, for consumption. And you would see, I didn't include pictures, but in other countries you would see the situation on what was happening. The health infrastructure was overwhelmed. We would see healthcare providers crying. I don't know whether we saw in that picture, in those pictures, even though it was probably overemphasized, as we had from Professor Lando, the George Gobner effect, that what is really talked about more. And that reminded me that the more I watched the news, the more I got depressed. So actually I decided I was not going to continue watching and let us do the interventions, because we were faced by this challenge in our own situation now. For me, as the person in charge of health in Uasin Gishu County, you find that probably you overwhelm all the people expect some direction and some magic, which is really may not be possible. We don't have magic answers. But as a result of COVID-19, that is when you heard about social distancing, we heard about infodemics now, the information provided, we heard about flattening the curve, self-quarantine, isolation, cough etiquette, lockdowns. I know there is a really, I don't know what people think about the lockdowns, but because of a pandemic, sometimes it's necessary. Sometimes it helps to contain at that time, and also it helps probably if the health system is overwhelmed, to just provide time for people to rethink of the strategies and see what are the best ways that we can handle this, because it's very, I would say it is really, having been in charge of health during this period, it's really overwhelming. It's really energy draining. You really have to have time to think very quickly, and it's unpredictable. You don't know how the disease is going to mutate. When the first wave came and it went, we were very excited. Now we have relaxed. When we are relaxing again, we didn't know that actually what happens with pandemics, every 3 months before it ends, probably you expect another wave, another rise in the number of infections. We had the second wave. We were able to handle again our health. But also the good side of COVID-19, we have been able to improve on our health infrastructure. Most of our counties didn't have probably intensive care units. We depended on the very few ones, but now we have those. We have oxygen. It has helped really. It has also helped in equipping the healthcare workers on how to manage emergencies. Then you have the hotspots, and then containment zone, buffer zone, and others. And that is when now you also hear, you get the dilemmas. When COVID-19 first started, we had, there was a panic. All the international travelers, people wanted to come back home. When they arrive home, no, you can't go and see your You can't go home, you have arrived, you have to be put on quarantine, post-quarantine. So really we have a lot of things to learn from pandemics, and also we have to realize that it causes more than just the health effect. You can imagine those who came in from other countries and they are forced to quarantine in some hotels and pay for themselves. These are costs. It brings in additional costs that we may not be able to really understand. And you can see some of the effects even in religion. I used Muslim, but we have Christians, we know what our churches now are. Previously, we would sit together in a bench. I remember we had Vespers. I really used to enjoy and look forward to coming for Vespers. I don't know what you're doing today. I think you must be having the social distance. And like then we could sit close to each other. So we really see that actually COVID-19 has a lot of effects that we have to do with. And the COVID situation globally and in Kenya, so far the total number of cases are 158 million. Globally in Kenya, 163,238. Those who have recovered globally are 136 million. And in Kenya, 191. Those vaccinated. I know probably we are still worried about vaccination. But for me, I took the test. I took the vaccine. And I know people still have myths about vaccine, but I would say the vaccine is still, it is safe. And it has been used in children to prevent, not this vaccine specifically, but other vaccines have been used in children routinely. And they were tested over time. Of course, this time, I kept on telling my colleagues, others were guinea pigs for us to get those vaccines. Now we are guinea pigs for others in future, so that it is identified to be safe. So in Kenya, 645, 450 million, globally, and in Kenya, 17,068. The deaths globally is just above 3 million, and in Kenya, 2883. So you can see, this is just a picture of cases per county in our country, and you can see where we have a lot of reds. That is where we have a high exposure. And the top 10, I've just put in there the top 10 counties that have, these are Mombasa, Kiambu, Nakuru, Uasin, Gishu, Machakos, Kajiado, Kilifi, Busia, Kisumu. And you see, like, I believe all of us go to Uasin, Gishu. We are just neighbors here. And you wonder why our neighboring county has and the others are not. That is how now you you start thinking about the hotspots, the zones that have high numbers. And it is as a result of many other things. First of all, it has an international airport. It is in the northern corridor. The activities that go on there, it is overpopulated more than, and the city around there. So there are several activities that go on in Eldoret or in Uasin Gishu that has probably caused these high numbers. And the distribution of confirmed COVID-19 cases by presentation. I just want to say the signs and symptoms, or what these people usually present on. A high number is just coughing. Then we have fever. Then we have difficulty in breathing. Then we have headache. Then we have sore throat. Then we have chills. We also have running nose. We have chest pain. We have general weakness and tiredness. So some of those, we really need to think about them. Sometimes people would say, I am feeling so tired. But because we understand the COVID-19 situation, it is necessary to first of all suspect COVID until proven otherwise. We have seen a lot of deaths, sometimes we unexplained, but because of this pandemic, this emerging disease has caused a lot of havoc. And the Kenya government has done a lot to contain COVID-19, and we would see it was led by the president. His Excellency the President used an all-government and multi-agency approach. And that, I don't know whether there are other, I don't remember the recent past that a lot of effort has been put towards containing such a pandemic. I know we had locust invasions in other sectors, even though it affected most of us, but I think the COVID-19 has really had a lot of impact, and that is why it required the whole government approach and individual approach. This is actually something that if we all did not take responsibility and give interventions, we wouldn't have managed to reach where we are. And I would say we have had, from my example, we sometimes, I have very good officers who can actually monitor the epidemiological trend. There was a time in early March, before even it was declared that we had a third wave, one of the officers told me that he had seen a rise in the cases in one of the communities. And actually we took intervention and the numbers went down. So some of these COVID-19, some of these pandemics just, okay, short term will require containment measures, those of social distancing, masking, but long term, of course, the vaccine would be helpful. We have also managed to handle the cases very well, even though they're sometimes overwhelming. And we've done surveillance at different points. At the entry points, we have done laboratory. We do a lot of contact tracing. In the beginning, when we got the first cases, we really had a lot of energy. One person, can you imagine how you'll ask them, who did you take breakfast with? Who did you take lunch with? When you went to the market, who did you meet? When you went to wherever they went, you can imagine how it was a very tough task. When you are in the matatu, and we know the matatu, now where will you get the people in that matatu? The 14 people. So really, it brought a lot of, it was a lot of challenges, but now we learned that now we have to tell people, in a matatu, in any public place, you really have to be taking precautions. I think I have said that. And I like this quote that I always like referring to the Cabinet Secretary for Health, Mutai Kagwe, when he said, if we continue to behave normally, this disease will treat us abnormally. And that is his quote. Of course, I didn't put it in quotation, I apologize for that, but it is a quotation that if we continue to behave normally, this disease will treat us abnormally. And I think we have seen it has actually treated us abnormally. And I think I have talked about the interventions that have been done, vaccination, the short-term measures, the social distancing we have seen in schools, institutions, churches, all gatherings. Even though I've realized there's a problem that we don't realize, this thing provides a lot of contamination. I would come in here as a presenter, remove my mask, and speak to the microphone. Really, one of the issues that spreads coronavirus is through saliva. So you can imagine if I remove my mask now, the saliva that goes in. The next person comes, removes their mask, the saliva. So these are some of the issues that when we are handling COVID, the interventions, let us keep in mind that it is our personal responsibility to protect ourselves. We've also, there are some of the interventions used are strengthening of enforcement of public health measures across the country as directed by the President, and then also cross-county coordination, like our county, I would say our Noreb region, at the start of the pandemic. Our governor, His Excellency Jackson Mandago, who is the chair of the North Rift Economic Bloc, actually convened a meeting among all the 7 regions in the Noreb region, and we had discussions on containment measures, and this worked well so much because we were talking together, discussing, and looking at the interventions that really work for us. And I talked about the contact tracing. Of course, it still happens now, but we do on phone. We don't do physically as we did earlier. The other problem we have now is commodity security. Managing COVID-19 patients, because of its highly infectious nature, requires use of personal protective equipment, and it's very expensive. So this has actually strained our health system. And that, it is not that we are only managing COVID-19, we still have the normal diseases that we were managing before this COVID-19. And another thing we know, we have, now we are doing rapid testing, and there is need to strengthen diagnostic quality assurance on such. Unlike the PCR, which you know that it is highly sensitive and highly specific. And I wouldn't go without talking about isolation. And isolation didn't start now. It started in the book of Leviticus in chapter 13, if you can read, when there was somebody with probably a skin condition, most likely leprosy, and was isolated for that to be cured. So it is really something that that is why it's emerging and re-emerging. So we really know that it comes from long time. And since there was little understanding of the cause of the disease at the time, many families, usually the marginalized, were confined in their homes, sometimes through force, and that's what we have seen now. That used to happen around the 5th to 8th century. People were forced. When we had, when COVID-19 came, what we were telling people is stay at home. If you don't have anything to do in town or in the city, do not come to town. We told the elderly, stay at home. So those are the things that we can see actually, like history is repeating itself. So I don't want to talk much. I think I've done so much about COVID-19. I would like to just mention about controversial issues in health. Like mental health, I know it is something that we are supposed to be treating it. There used to be a saying that all of us are mad, but the degree of madness is what is different. So we have such dilemmas. How do we manage, like the mental health cases? Are we supposed to handle them in the community? Or do we leave them in the streets? We see them in the streets. And what should we do to them? Should we force them? Sometimes, yeah, when they become harmful to the people, we force them and take them to hospital. There's something to do with abortion. There are those who are pro, those are against. These are some of the controversial issues in health. If you had debates, those who talk about legalizing of abortion, there are those who talk about even use of contraception. There are so many dilemmas in healthcare that really, and controversies that really still remain controversial. The issue of euthanasia. Do we allow, when someone says, I don't see that I am going to continue, my prognosis is very poor, I don't think I'll continue living. Can you just give me something to take me very fast? So those are some of the dilemmas. Medical legal issues. When a doctor is providing care and accidentally something happens to the patient and they die, are they liable? You know, those are things, they were not doing it intentionally, but probably it happened accidentally. The issue of surrogacy, the issue of forced quarantine and isolation. And this one I have a very real example. When we came, when at the start of COVID-19, when there was a lockdown in Nairobi, and as we were not locked down, we actually used forced quarantine. There was a kaplelach. I don't know whether people know about kaplelach. And it really helped us. When people hear about kaplelach, but you know those are controversies. People actually ask us, why are you doing forced quarantine? And what we were doing is, if we find you, like in your house, you have brought in a certain number of people, we will take you on quarantine, forced quarantine, because you are exposing the population. If you have come from a dense place like Nairobi, that time it was a hotspot, and it has been it has been locked down and we find that you came from from Erebedo in Eldoret, we would also take you to the quarantine. Of course, it helped, but also it has its own challenges. Others, there are so many controversial issues that I may not be able to talk about, but also some dilemmas like availing birth control pills to the teens. Is it acceptable? Is it acceptable just normally or even religiously, or depending on our philosophical views? And I think I talked about mental health. And then now, who should address emerging, re-emerging issues? That's the question that I pose to this audience. Who should address these issues? I think it's our responsibility, those who are directly affected, those at risk. We are all at risk, and that is why we are taking these measures that we have done to address COVID-19. And those of us living in the community, and we all live in the community. We also have policymakers, legislators, officials, or others who can affect the issue, administrators, respected local leaders. Actually, I learned, every day is a learning day. I learned the importance of the local leaders when we got the COVID-19 pandemic. That is when you look for the village elder to talk to the people. You would look for the church. Actually, we did so many meetings with the church, with the chiefs, Matatu associations, people that we never interacted with in our time of provision of service. But that is when now you realize when this disease came, it treated us, it made us to think in a very different and strategic manner. And that brings in the end of my presentation today. And thank you all, and God bless you.
Thank you so much, Dr. Rotich, for that powerful presentation on emerging and re-emerging issues on health. I remember I am a member of research committee, and when we were coming up with the sub-theme topics, an idea struck my mind. We were brainstorming, and then I said, how about a topic on emerging and re-emerging issues, global issues. And then when we brainstormed further, we said, why don't we put it as a topic in health? Little did we know that we would actually have an emerging issue of health today. And your presentation has educated us a lot. To begin with, on determinants of health, very, very key. You have given us the history of the pandemics, beginning with the Great Plagues, even cholera, which we nowadays take so casually. Was a real pandemic then, including influenza and now the great COVID-19 that we are battling with. You have also touched on controversial issues, and the list was long. And finally, you are calling our attention on who should address these issues. And conference attendants, including those who are online, I know you have some questions, and this is the time to pose the questions for discussion. Okay, Dr. Keses.
Thank you so much. We are proud of you, and we are happy that you are one of us. Just seeing you here is fresh air. And we pray that you go much further. Now, I have two questions. The first one is about medical records. Yesterday, we had a presentation on cancer by Professor Mwena, and he told us that in his research, while looking for records on cancer, only 10 counties had records. And I know another friend who was attempting to do a research on cholera in masters in Kenya, and the friend had to abandon that project because there are no records. This problem of records. How do we manage our health, looking back in history without records? Number two is about corruption. We have heard of KEMSA. We have also heard of counties that money came to deal with COVID, but most of that money that was given to deal with COVID never addressed COVID, but it enriched a few individuals. Of course, generally Kenyans, we don't mind corruption, particularly if we are beneficiaries or if people of our tribe are beneficiaries. But to what extent is corruption affecting, the provision of health? If there was no corruption, where do you see this country? Because where you are sitting, definitely you see better than us. Where do you see this country, this county Uasin Gishu, if there was no corruption? Those are my questions. Thank you again, Mheshimiwa.
Any other question? Okay, Dr. Ohonya.
Thank you very much. I think I would also want to add my voice to what Dr. Kesis has said, that we're indeed proud of anyone who is our alumnus, and it's nice to see you here. Now, I have two questions. One of them is that recently, the government announced that there are some counties that have not utilized the COVID-19 vaccines, and those COVID-19 vaccines that have not been utilized should be returned to the national government. Where does Uasin Gishu County stand in terms of its utilization of those vaccines? Then you touched on one topic that is of a great interest to me, and that is the issue of surrogacy. How is that in Kenya, as it were, in terms of practice, legality, and all that goes with it? Thank you very much.
There is a link. Then we'll come to
Yeah, thank you very much for your presentation. I know that in Eldoret we have Moi Teaching Referral Hospital, we have Moi University that has produced, quite a number of good doctors and good professionals. I want to know what role the universities around, especially Moi, and probably what role we could play, especially in regards to health. We thank God that you have been a student here, and at the same time you're in county government. I want to know if there has been any help you've probably asked for or received from universities, or how have you engaged them to be able to solve some of these challenges that we have in health? And then also coming from the ICT sector, I have seen, especially in developed countries, ICT has been of great help, especially when it came to vaccines. One of the things that made them take a shorter period was using ICT, artificial intelligence, to help. But have you involved probably that sector also in collaboration with government to see that we are also not necessarily looking at maybe biological solutions, but we also have other sectors that can help us to deal with the challenges that we have?
Okay, we will take the last question from Professor Lando.
Thank you very much, Dr. Rotich. Thank you, Chair, for the opportunity. Mine is a general question about how government and county government in this sense, and specifically the one of Uasin Gishu, how can you partner with academic institutions, especially on this side we are talking about Baraton, but if you can talk to your colleagues out there in other counties, government, you know, the government and academic community, we work hand in hand. And if we are to come up with action research, same thing, governments are also looking for solutions to societal problems. Is there a budget allocation that can be put aside for research with the specific involvement of institutions of higher learning, universities, to work with governments, national government and county governments, so that together we identify societal problems and come up with societal solutions, so that we are not working at loggerheads, we are working together for the common good of our people. So do we have a research fund that universities can tap into, apart from the National Research Fund? Thank you.
Dr. Rotich, you can respond to the questions.
Thank you very much for the questions. They are really very good questions, and I appreciate. And first of all, I want to say I forgot to appreciate all the leadership of the university, the council, the university council, the board, and the administration, the management, being led by the Vice Chancellor, the scientific conference organizers too. You all did a great job to allow this session to occur and to share the knowledge. Somehow I thought about medical records, I thought about IT, but I thought my presentation would last the whole day. So that is why I didn't talk about some of the very critical issues. So I really had to battle on what to present. And I had to really dwell on the current situation that we are in. Medical records, I know you have talked of cancer registry. At the moment, my people are working on our strategic plan. And one of the issues we want to do is have that cancer registry. I know we don't have it ourselves. It is domiciled in MTRH for us, but we are working now as a county, and we have agreed, once we are done with our strategic plan, there are those that really don't require resources for us to implement, and we shall do that. It's just a bit of sensitization to our staff and provide documentation and provide the necessary tools. Then we shall be able to have that. Having worked in government now, you know, I left the university when things are very straightforward. I was that person who knew, I was just waiting. When I finish, I go to class. If you're absent, I mark my sheet, I do my attendance. My work is easy. End of the term, if you didn't do 80%, 20%, you have failed. But you know, that is not the kind of life in the government. There are so many things that you really have to consider. It's not really straightforward. It depends also on the vision. You really have to bring people together to understand what we need, because you realize we are not. If you saw that change, the change figure that Professor Lando brought, there are those innovators, the innovation thing, and then there are the laggards, and then there are the late acceptors. That happens in all institutions. For even change to occur, it is not something easy. You may have actually the beautifully done strategic plan, but if you look at the dynamics, you are working in an environment that probably people don't have that knowledge. They don't really understand the value of having certain things. But as counties, we work together. We have the intergovernmental coordination mechanisms. We meet as CECs, and we encourage each other to have certain minimum structures and systems. It may take time, but I think we are on the right direction to have those records that if one time you need records, like even for that, what you were talking, that somebody was doing a study and they couldn't get the records and they abandoned that. It is sad, but those are things that realities, we are live to them. We are working very hard, both the national government and the county government, albeit slowly, but we shall be somewhere in time. We have a very good working relationship with Moi University, with MTRH. And I forgot to say, MTRH was our coordinating center when we had the NOREB meetings. And they really helped us. Like for us, we have a working arrangement. Most of our referral cases, the higher tertiary cases, we send them to MTRH, and we dwell more on the primary health care. The partners helped us a lot. I would talk like the AMPATH, which is Moi University and MTRH partnership, helped us during the initial, when we had the COVID-19 pandemic, the initial period. We had to do door-to-door sensitization of the population. And AMPATH really helped us in that. They gave us logistics, and we were able to realize a very big number of sensitization, which really helped us in bringing down the numbers. The issue of corruption, definitely, this is something that probably, also with that issue that we know corruption has occurred. All our counties have been audited. We were also taken to KEMSA, my county, and we were told that you have bought gumboots at 6,000 shillings. You have bought masks at 1,500 shillings. But you know, some of these things are maybe beyond us. And that's why I say, whose responsibility is that? You are the person now, the shopkeeper selling gumboots. You have seen now this pandemic, and you say, wow, it is my opportunity now to sell my products very expensively. So for us, we have no choice. Sometimes you just have to buy because it is what is available at the market, and you need it to use. And I wouldn't say that, I know people think now, when they hear I'm the CEC for Health, they imagine I'm a very rich woman here. But it's very difficult. We have systems in government, and even buying a bottle of water, it has to go through the procedure, the procurement process. Sometimes it's very tedious. During the pandemic time, there was a time my staff called me at 8 p.m. on a Friday that we have 2 deaths, COVID-19 positive, and we don't have PPEs. And they must be buried. You remember that time, the way it was dramatized, the way you must bury in a certain way. People had to don in very white, very many. And I had to look for those PPEs in the night. And there was no funds for that. So I had to dip into my pocket, and getting back now that refund. Actually, I haven't refunded up to now because it was an approved expenditure. But people will just imagine that you are stealing. And yet, probably people don't understand that when we are in offices, there are those who would go in probably with the intention of amassing wealth as much as possible. But there are those who will go to government with the passion and the intention to provide care and to change the world. So we are faced by these dilemmas, but still I would say, with corruption, I know the government has done a lot to deal with the corruption. Of course, there is much that can still be done. And I think if we can understand the systems, we will know that probably, yes, there is corruption. Where does it occur? It also reminded me when I was reading this, I wanted to talk about the other global issues, and even in other sectors like finance, the huge loans. I also keep asking myself, if I was the Minister for Finance, would I take those, would I advise the President that we take those billions of loans, the Eurobond? We know those issues that happened. We know KEMSA issues that happened. We know the MES issues that happened. But I think the other thing I would say is, if we could tackle corruption and in a very objective manner, and you may be punishing the wrong person, and we know who is actually, if we go deeper and know who are the ones involved, and sometimes they are known, but you would find that even the Mao issue, you would hear, they say they take the small fish and leave the big fish. It doesn't mean that when you're taking small, corruption is acceptable. No, it isn't. The other issue about ICT, I also thought about ICT. We use it in health a lot. What has helped us it has done a lot in our sector, like even now, the current COVID-19 vaccination. We get real-time data on how many people we have vaccinated daily, because there is an app that is being used and it really helps. And we are doing well as was in Gishu County. I think we are the 4th leading county that have, I should have brought a diagram on that have immunized, but I think I have it in my computer. I can just say how many. I think we are over 40,000. There are other counties that are really not doing well, but we also noted a decline in the number of people coming for the vaccine when there was an announcement that there was no assurance for the second dose. So there are so many things that really interfere with the seeking of health, the health-seeking behavior. Now we had very many people coming in. All of a sudden, when that announcement was done, what was in India was shown. People said, now, how assured are we that we are going to get the second dose? Many people kept on asking me, are you assuring me that I'll get a second dose? Then I tell them, first of all, before I assure you, I also took the dose and I need a second dose. So we also have to know that we are all affected in the situations that arise. And I think there are many ways that the government can partner with academic institutions. For us, we usually partner through memorandum. We develop memorandum of understanding, and we do it. It doesn't take long. The only challenge I would say, it requires, maybe we need to have an office for research that would be handling such. You find that you have so many things that you want to do in the county government, but you get overwhelmed. Sometimes you see, I don't have enough staff. Now, should I bring that nurse in the hospital to come and do coordination activities, or I need her to provide care to the patient? So you see, those are the issues that we face, the challenges. Even though we don't have research funds, but in the budget making process, it is possible to include, even if it is 100,000 or 200,000, it is really possible to have that seed fund in the budget making process. Once there are collaborations like that, and it starts early, the government works in a cycle where we have the fiscal strategy paper. When it is being developed, if we put in aspects of research, and not only that, if we start with the county integrated development plan, which is done every 5 years at the beginning of government, if those are put in the CIDP, then have champions pushing for them. Otherwise, they'll be ignored. But it is really possible to have those resources in our budgets. And I think we need solutions, and I asked who is responsible, and I would still say we are all responsible to having the society that we want to live in. I don't know if there's any question I have forgotten. I think Dr. Mutua.
Yeah, thank you for your presentation. And mine is a follow-up question on records. Now, this is a digital age, and some of the records in the ministries are just hard copies. In your area, are you going digital or you are combining?
Thank you very much, Dr. for such a wonderful presentation. I also have just one concern. There is a paradox out there that many people come to the hospital, especially like MTRH, being a national referral hospital, very well, probably to seek for some consultation, and they go out with COVID-19. And this has actually been in the limelight out there. Somebody is sick because of that. Could there be something extraordinary besides the measures that we know that probably the county government is doing to cap that? Thank you very much.
Yeah, yes, sorry, I can answer. Okay. Thank you very much for the health records. We are aspiring. Right now, the government is rolling out an electronic medical record system that is going to be mandatory. Sometimes we must be forced as Kenyans to take up some things. Even though we know the benefits, they are very important. We started an HMIS, Health Management Information System in our county. It's functional in a few facilities, but the uptake in all the other facilities is not really good. And it is associated to different issues. First of all, I would say some ascribe it to internet connection, internet connectivity. When someone is having several patients and there is slow in internet connectivity, someone would prefer that queue and this is disturbing me, so let me do the local, let me do the written, let me just do my records, my handwritten records, because what time am I clearing the queue? What time is the internet giving me trouble? Sometimes it's also our attitude as healthcare providers when you don't see the need or you don't believe in it. And also we need policies that would guide it so that we say this is a policy direction that has been provided, and also support people so that you have the infrastructure, the knowledge, many issues. So my answer is we are not fully, but we are hoping to add towards there. Then there was one. What was the last one? Sorry? Plus, remind me your question. What did he talk about? Oh, MTRH. Thank you. He talked about MTRH and the spread of COVID-19. We have talked about social distancing. We have actually said, if you have a cold, please don't go to MTRH. Go to your next health facility. So we also need to take that responsibility. MTRH has done, our hospitals have done what it could do. We have told people, wash your hands. But because now there is congestion, definitely there is no way you will avoid getting COVID. And majority of patients seen in MTRH do not require MTRH services. So that is where now we go wrong as ourselves. That's why whose responsibility, the way you are believed that the best hospital that I know, for a long time it has only been MTRH. But we need to explore. I don't know which is the nearest health center here. If we could go there, you would get the services, you would get the care, and you would be treated and you recover, and you have prevented yourself from getting infection. But if we all stream to MTRH, we of course cause a strain on the infrastructure. We also expose ourselves. Thank you very much.
Thank you so much for your response to those very important questions. And now we have come to the end of the morning session. It is time for us to go for lunch. And when we come back, we will go into breakout rooms. We will have those who will stay in this physical hall 1, virtually session 1, and then we will have the physical hall 2 and virtual session 2, and now you can look at your programs and see where you would prefer to go to. And before we go out for lunch, I would request Dr. Wahonya to come and pray for lunch.
Shall we kindly rise so that we can pray? Let us pray. Our gracious and loving Heavenly Father, we want to thank you so much for allowing us a chance to be here as teachers, as scholars, and deliberate on these different presentations. We thank you so much for our two guests who came in and accepted to grace this occasion. We pray your blessings upon them, blessings upon their work, that, dear Father, your unfailing mercies will attend their ways each and every time, dear Father. We want to thank you for each and every one of the attendees, our teachers, oh God, and staff members who are also attending this conference. Bless each and every one of them too. As we go for the lunch break, we pray that you bless the food that we are going to partake of. In Jesus' name, amen. Amen.